A report by the Zoonotic Disease Unit has revealed. Now, in a forum organized by VSF in Rumuruti, Laikipia, healthcare providers have been urged to consider one health approach in safeguarding the lives of people, livestock and the environment.
It is estimated that 2 billion people at the global level are affected by zoonotic diseases, and another 2 million people die from these diseases. According to Hadija Chepkorir, a veterinarian, the recent case of outbreak of anthrax in Murang'a, where a farmer lost 2 animals, each worth 200,000 Kenyan shillings, is a big loss considering the additional cost of milk production.
The global level, for instance, an estimated 2 billion people are affected by zoonotic diseases. Another estimated 2 million people die from these diseases. An example of the recent outbreak of anthrax in Murang'a, that particular farmer lost 2 animals. Each of those animals was worth 200,000. So that is 400,000 worth of the animal the person has lost. And we have not even put the cost in terms of milk production, because this farmer was selling milk.
Professor George Gitau from the Faculty of Veterinary Medicine at the University of Nairobi says that they have done 2 studies within East Africa, one in Kenya and another one in South Sudan, where they analyzed and skimmed over 1,500 samples collected, and they established that there is some degree of exposure to this very important infection. Gitau has urged the pastoral communities to be very cautious and to always work closely with the vet authorities.
During the deliberations, one of the things that was very clear and discussed is that zoonotic diseases are very important at the human livestock wildlife interface. We've done some 2 studies within East Africa, one in Kenya and another one in South Sudan, where we analyzed and screened over 1,500 samples that were collected. We established that there is some degree of exposure to this very important infection. So I would want to remind the communities that live close to animals, especially in the pastoral communities, to be very conscious about this.
Dr. Nasir Lekudere, a county executive health officer in Samburu County, says that they have faced challenges of people feeding on carcasses and having outbreaks of food poisoning as a result of that, hence the need to work as one team so as to address the issues, adding that they intend to work with the community health promoters to educate the public.
And in Samburu, we have faced some challenges, especially of people feeding on carcass. One of the things that as health we intend to do is to use our community health promoters, because those are guys who are taking care of the household, especially in terms of health education, disease prevention, and also the treatment at the community.
Maureen Nyakiradio Bosire, Look Up TV.